Affordable Care Act. What did the Democrats do right? What did they do wrong? What did the Republicans do right? What did they do wrong that ended up in that piece of legislation?
Well, what they did right was make an attempt to offer affordable health insurance to all Americans. What they did wrong was trying to force people into a system that some people just didn't want to belong to. And then in terms of how they legislated it, they made the fatal mistake of shoving it through on a one-party vote. Big things in America that are lasting happen on a bipartisan basis. And so those were the pluses and minuses of what happened. And I'm sure we'll have a chance to talk more this morning about where we're going from here.
We might. So, Governor, from a state perspective, you looked at it differently. You saw perhaps a different perspective. You come from a different side of the aisle.
I thought there were two goals, and that was to increase accessibility and affordability. And I think we certainly succeeded in the first instance. Before Obamacare, there were 48 million Americans without health care coverage. There are now 28 million Americans without health care coverage. That's 20 million people. That's an enormous amount of people to get additional coverage. We're down to 8.9% uninsured in our population, the lowest we've ever been. So I think they succeeded in that regard. Where they failed, I mean, and I'm leaving aside the computer glitches and things like that, where they failed is on the affordability side of the equation. There wasn't enough emphasis and mandates for cost cutting that there should have been. It didn't include some of the technological advances. I mean, for example, we're here to people who use the information system to do things like telehealth. I'm the president of the board of Jefferson University Health System, and we use telehealth throughout the state of Pennsylvania, particularly useful for small counties. Many small counties in Pennsylvania have lost their primary care physician. And we tried to deal with that by increasing the scope of practice for nurse practitioners, but telehealth has been an enormous help in doing that. There's some pilots for medical homes, but medical homes are a far better and more cost-effective way to treat patients that wasn't mandated. They left a lot of things off the table on things that would reduce the cost of our healthcare delivery system. What the Republicans did wrong, and again, it's always who struck John, is not trying to work harder to reach consensus. There was that group that started off with Senator Grassley that I thought was going to really try to do some things together, and it broke apart. Whose fault that is, we could talk for a long time. But the remedy now is easy. We should get rid of Obamacare and keep the Affordable Care Act.
We'll get to the conversation of repeal and replace, but I want to come...
But you have to understand, it's quite an accomplishment to get every Republican in the House and Senate to vote no. Even a greater accomplishment to ever get them to vote yes.
Right.
I think we're working on that, aren't we? Take us back, though. You were in the House, and you had to have been part of some conversations, and at some point it broke down?
None. None.
How did it play out?
None. On the House side, we were never invited to a conversation, never invited into a room. And understand what happened. The Senate passed this with 60 Democrat senators. And after it passed the Senate on Christmas Eve in 2011, Ted Kennedy passed away, and the bill had not passed the House. And so when it came over to the House, if they had changed anything in the bill, they would have to go back to the Senate. They didn't have 60 votes. And so they knew they had a flawed piece of legislation to begin with, and they had no choice in their minds but to go ahead and just pass it.
So play it on out over the next couple of years. A premise that I have is that the Democrats just didn't feel that they had a position to reopen the discussion to fix it. Because normally with you guys, yeah, you pass something and then you have to come back. You learn some things and you fine tune it. We never had that opportunity over the next 6, 7 years.
No, but because we had been closed out of the initial conversations, we didn't have our fingerprints on this, and the problems weren't our problems. And if they would have opened the door, we would have worked with them to fix some of the problems they wanted to fix, but we would have wanted to make some changes as well. And but they had no interest in the changes that we were willing to offer.
Yeah. So now let's come forward. The Republicans' fingerprints are going to be all over what's next.
All over it.
Yeah. So, couple of things to sort of talk about, and then I also want the state perspective in terms of Medicaid expansion and the related issues to this. Are the Republicans going to do it any differently than the Democrats did?
I don't know. I think that's going to be a work in progress. But most of the Affordable Care Act, in the framework is going to stay there. You know, coverage for kids up to age 26, covering those with pre-existing conditions, all of that's going to be there. Subsidies for those who can't afford it, who aren't on Medicaid, but what I'll call the working poor, subsidies for them will be there. But what will be different is that a CMS will not dictate to every single state exactly how the plan is going to run. And if the state wants to run an exchange, the state can run an exchange. The states will control the policies that are offered like they control every other insurance product offered in their states. And so this is not all that hard to figure out, except this. In the 25 years that I served in the United States Congress, Republicans never, ever, one time agreed on what a health care proposal should look like. Not once. And all this happy talk that went on in November and December and January about repeal. Yeah, we'll do replace. I started laughing because if you pass repeal without replace, first, anything that happens is your fault. You broke it. And secondly, as I told some of the Republican leaders when they asked, I said, if you pass repeal without replace, you'll never pass replace because they will never, ever agree on what the bill should be. Perfect always becomes the enemy of the good. Mm-hmm. And so you've got to you marry them together. It's the only chance we'll have to get it done. That's why it's taken a lot longer than people had anticipated.